Hey guys, this is Dan Cassidy, creator of Dry Rub, and I'm here with Dr. Ryan Godfrey. Dr. Ryan is a doctor of physical therapy, and he works with athletes to help them achieve their peak performance. He also helps people prevent and recover from injuries, and today he's going to talk about trigger point therapy and how that actually works.
Okay guys, so we're going to talk about the concept of trigger point therapy that Dan mentioned. So inside of Dry Rub, there are strategically placed areas, much like a lacrosse ball, right? If you think of that split in half, those are placed in certain areas where you have tension built up after your WOD. And really the concept with trigger point is that we're placing the ball in areas that have tension built up after deadlifts, after squats, right? Oftentimes those areas get tight and tense. It's not necessarily due to poor form or technique, it's because we're using those muscles. So as a way to recover, we can place that ball in areas that commonly get tensioned, and specifically the paraspinals. We have a muscle called quadratus lumborum that attaches from your rib cage to the top aspect of the pelvis. With that ball, it can be strategically placed there to relieve tension. And what we're looking for with trigger point therapy, we're not breaking up muscle tissue or scar tissue like we thought we were, but in fact, just by placing superficial stimulus to that area of the tension muscle, that sends feedback to our brain to get this tension to reduce off. And that's what goes a long way in recovery. A lot of times we just hop in the car, we go home, we hop in the shower, we haven't done anything for soft tissue work or any mobility work. That's what Dry Rub allows you to do. So we want to touch upon how Dry Rub really fits into your recovery regimen, right? And the big concept that we have, really you have a half-hour window at the end of a workout to where you can lock in some mobility gains and really get active recovery. So the way Dry Rub fits in, hey, we don't always have time to foam roll out or to get the lacrosse ball in there before we go home, and we got to cook dinner and do all those things each night to get ready for the next day. So this really fits in line with that, the fact that on the way home you're getting that soft tissue recovery. Now maybe you got some spare minutes, you can do some dynamic or passive stretching to bring that recovery all together.
So thank you very much, Dr. Ryan, explaining how trigger point therapy works. And for everybody watching this, make sure you're making the time to use a foam roller or a lacrosse ball after your workout to help you recover. But if you don't have that time and life just gets in the way, as it does for most of us, check out Dry Rub. It can help you stay ahead of the game and stay nice and fresh and stay mobile after your workout.